stream if they would like to be addressed in the minutes. Roll call vote will be taken for each motion to ensure all members remain remotely connected. Danielle, roll call, please.
Melanie Beam.
Here.
Heather Campbell.
Muted, but
Jen Demuth. Ryan Dunn.
Here.
Kelly Engelhardt. Brian Kress.
Here.
Mark Murphy. I see you. Jeff Niding.
here.
Marion Audie.
Here.
Holly Peyton Miller. Paul Rossi. Julie Smith.
Here.
Maureen Stoneman.
Here.
Quorum.
Board staff introductions, please.
Natalie Boland, board staff.
Hillier, board counsel.
Danielle Lurie, board staff.
Michael Dotz, board staff.
Michelle Sayer, board staff.
Veronica Stryker, board staff.
Any guests that you're seeing, Mike, in any way?
None.
We're not seeing either, so, okay. All right, so we have an agenda that's been set out. Just need a motion and a second to approve the agenda, please. The revised one that was sent out just today.
I'll make a motion to approve the agenda. This is Julie.
I'll second. It's Maureen.
All right, roll call vote, please. Danielle?
Melanie Beam.
Yes.
Heather Campbell.
Aye.
Ryan Dunn.
Aye.
Brian Kress.
Aye.
Mark Murphy.
Aye.
Marion Audie.
Aye.
Polly Peyton Miller.
Aye.
Julie Smith.
Aye.
Maureen Stoneman.
Aye.
Okay, motion carried.
Thank you. So the board meetings were sent out. The board meeting minutes from October 21st were sent out. Hopefully you've all taken time to review that. And we'll need a motion and a second to approve the meeting minutes from October 21st, 2020.
I motion to approve those minutes.
Thank
I
you, Ryan.
second Heather Campbell.
Thank you, Heather. Any updates, corrections anybody knows of? All right, roll call vote, please, Danielle.
All right, Melanie Beam.
Aye.
Heather Campbell.
Aye.
Ryan Dunn.
Aye.
Brian Kress.
Aye.
Mark Murphy.
Aye.
Marion Audie.
Aye.
Polly Peyton Miller.
Aye.
Julie Smith.
Aye.
Maureen Stoneman.
Aye.
Okay, motion carried.
Excuse me, Danielle.
Yes,
This is Jennifer Demuth. I'm here. I vote aye as well.
I'm sorry you snuck in.
Yeah, you were all voting on the first motion as I came in.
I had my head down. Thank you.
Yep, thank you.
I'm trying to get video back. It just went away, and that's was my problem connecting before was that. So it may work, may not. So budget committee, Julie. Can you hear me okay?
Yes.
Okay.
Sorry, I'm here. We met as a budget committee just prior to the board meeting, and we bring to you the budget committee recommendation for the then and now certification approval request that you will see on page 11 in your packet for the Carroll County, I think it's Common Pleas Court, in the amount of $7,298.46. And this is, as Michelle explained to us, in budget related to expenses incurred with their SOAR grant. Is there anything else you would add, Michelle?
It was just incurred prior to the beginning of the prior to the beginning of the calendar year. It dated back to October 2019, and purchase orders did not cross over the calendar year. So they were slow in billing, and that's why we have a then and now.
Are there any questions from the committee. If not, we would need to take a roll call vote to approve this then and now statement as presented on page 11. Okay, I think we could take a vote, Danielle.
Melanie Beam,
Aye.
Heather Campbell,
Aye.
Jennifer Demuth,
Aye.
Brian Dunn,
Aye.
Brian Kress,
Aye.
Mark Murphy,
Aye.
Marion Audi,
Aye.
Polly Peyton Miller,
Aye.
Julie Smith,
Aye.
Maureen Stoneman.
Aye.
Okay, motion carried.
Thank you. The next item is the review and approval of our expenditures for November of 2020, and those are on pages 12 and 13 in your packet. And the Budget Committee brings to you our recommendation or motion to approve those expenditures in the amount of $362,740.71. Most of the items on the list of bills are usual and typical expenses. You'll see on the second page, the Carroll County Common Pleas Court expense that we just talked about is showing up on the list of bills. And there is a expense on the first page of bills related to an annual insurance fee that we are paying to Westfield Insurance Company. Is that correct, Michelle?
Yes, that's for property and liability.
Are there any other things you would like to point out?
I know you mentioned in Budget Committee that New Philly Schools
Mhm.
is billed for their prevention K through 12 funding. So that's 42,000. That's on page 13, number 740. You can see that there. So we have 3 outstanding schools that we have not reimbursed or not paid for their prevention programs yet, but we are keeping an eye on it.
One question. The podcast and website expense, what's happening with that? Was that related to getting the word out about the levy, or was that something else?
So,
Go ahead.
okay, we just received a grant. I think I briefly talked about it during the last meeting. And when I originally wrote for the grant back in June, I included the cost of the podcasts, assuming that the break the stigma would relate to the purpose of the grant as well as serve as a benefit for our levy. We
Gotcha.
have to find out, because we didn't hear about the grant until September, how far back they will date. So it is likely that some of them will be included in this grant, but potentially not all.
Okay.
Any other questions? All right, if there are no further questions, we will need a roll call vote to approve the list of bills as presented.
Melanie Beam,
Aye.
Heather Campbell,
Aye.
Jennifer Demuth,
Aye.
Brian Dunn,
Aye.
Brian Kress,
Aye.
Mark Murphy,
Aye.
Marion Audi,
Gonna abstain.
Polly Peyton Miller,
Aye.
Julie Smith,
Aye.
Maureen Stillman.
Aye.
Okay, motion carried.
All right, moving along, we have the review and approval of financial statements through October of 2020, and those are found on pages 14 through 17 in your board packet. The Budget Committee comes to you with the recommendation to approve the balance sheet and the statement of revenue and expense as presented in the board packet. And we did note in our Budget Committee meeting that Our revenue and expenses sit at approximately 30% of what we expected to receive and budgeted for. And we are about a third of the way through the year. So Michelle felt that we are on target in most areas. Michelle, would you like to add anything else?
I think you did a good job.
All right, I just parroted what you told us.
Thank you.
Are there questions from the board about those pages 14, 15, or 16? Okay, then we need a roll call vote to approve the budget committee's recommendation or motion to approve these statement of revenue and expense and balance sheet.
I'll motion approval. Brian Dunn.
Okay, well, I'm gonna do roll call. We don't have to have it as, it's on behalf of the committee, so we don't need a
Oh,
motion, so,
Sorry.
but thank you. I appreciate that. Melanie Bean,
Aye.
Heather Campbell,
Aye.
Jennifer Demuth,
Aye.
Brian Dunn,
aye.
Brian Kress,
Aye.
Mark Murphy,
Aye.
Marion Audi,
Aye.
Polly Peyton Miller,
Aye.
Julie Smith,
Aye.
Maureen Stoneman.
Aye.
Okay, motion carried.
Thank you. The last item that the budget committee discussed and brings to you today is found on page 18 in the board packet, and that is some budgetary adjustments that need to be made. And Michelle, would you briefly explain why we need to do this?
Sure. The first set, the calendar year 2020 additional appropriations are just requests to move funding out of unappropriated into an appropriated service. As you'll see, the first one's $200,000 from unappropriated into contract services for the general fund. And looking at our available encumbrances or lack of available encumbrances, we needed to move some funds into those accounts so that we can pay all of our expenditures in December. I didn't want to get stuck paying only a portion of them and then have it go over the year. So I made them within what the unappropriated amounts were. I didn't use all of the unappropriated, but that's what needs to be approved so that we can definitely pay our bills next month. The one after that is a fiscal year 2020 federal fund advance repayment. We typically, well, actually every year we advance $87,500 into the alcohol and drug services line item from our general fund, and $50,000 from the general fund into the, oh my gosh, that shouldn't be A54. I'm sorry, that should be A55. The 50,000 should be A55.
All right, so we need to make that correction on page 18.
Yes. Actually, oh my gosh, I totally botched this. It's 60,000 from A55.
All
This-
right.
This was an old, I'm
Well,
out, guys, that's my mistake. I must not have put in the correct one.
so it should read like you have 60,000 on A50 from general fund to A55 on women's set aside. So above that, it should also be 60,000 from
Right,
A55
right.
from A50. Okay.
The amounts
Okay.
on 21 are correct. They're just coming from, they're getting re-advanced. The first one is advance repayment. The second one is an advance, and that second line on the advance repayment should almost mirror the second line on the advances.
Okay, so I think then we do need to probably make a motion and a second for this item since it's been revised since we were in the budget committee.
I'll make that motion.
I'll second Heather Campbell.
Okay, thank you.
Excuse me, just a point of order. Should the motion say that we are moving to accept it with the revisions noted during the meeting, just to cover the revision part?
Yes, I would agree that we need to state that it's the information presented on page 18 with the revisions discussed during the meeting.
Yeah.
So that was, I'm sorry, Maureen, you seconded that, or
Yeah.
did you make?
Heather Campbell. Heather
Oh,
did.
okay, okay. All right. Are there any other questions from any board members about what Michelle has explained here? If there are none, I think we would be ready for our roll call vote.
Okay. Melanie Beam,
Aye.
Heather Campbell,
Aye.
Jennifer Demuth,
Aye.
Ryan Dunn,
Aye.
Brian Kress,
Aye.
Mark Murphy,
Aye.
Marion Audie,
Aye.
Holly Payton Miller, Julie Smith,
Aye.
Maureen Stoneman.
Aye.
Okay, motion carried.
All right, that concludes the report from the Budget Committee.
Thanks, Julie. We'll move right on to the next committee report, number 3, nominating committee. Mary Ann, what you
The
got?
nominating committee met October 28th. Minutes are on pages 19 and 20. Natalie introduced prospective board member Aaron Menard. Aaron stated he's a recovering addict and therefore would be applying for the open position on the board as a AOD primary consumer. Aaron's a pastor, and he and his wife also own and operate the Holy Cross Cafe. Natalie gave an overview of board members' roles and responsibilities. Committee members then shared their reasons why they serve on the board. Aaron said he'd love to serve others in this capacity and felt his past would be beneficial. He also said he thought he could commit the time necessary to serve. After Aaron left the meeting, committee members discussed Aaron as a strong candidate, although they would like to interview other possible candidates. And that is all I have to report.
Okay, anybody have any questions on the nominating committee?
This is Julie, and I'm just wondering, are there some other potential candidates that, Natalie, that you will be bringing to the nominating committee?
There is at least one. He has a family member who works at a provider agency, and we did that with another board member. The state didn't love it, but there's nothing in statute or guidelines that prohibit it. He may have to abstain if he would become a board member from some of our votes, but he's expressed interest, and I'm just waiting to see if he's going to complete the application and get it back.
And specifically, he needs to fill the AOD first consumer spot, correct? Okay.
And if anyone else is aware of a consumer in recovery for a little while and would like to discuss their potential for board membership, please give me a call. The people that are consumers, the mental health and substance use consumers tend to be some of the most difficult spots to fill.
And maintain.
And maintain. Correct.
All right, anything else for the nominating committee? If not, we'll move on to the Tri-P committee. Maureen, what do you have?
The Tri-P committee met last Friday. We just had one policy that we went over. It's actually a brand new policy that deals with a policy regarding social media and who has the ability to post on behalf of the ADAMHS board, or, you know, if you are posting and you use the ADAMHS board name, what procedures and policies that board members and employees, staff need to follow. It was Prior to this, we did not have a social media policy. Thought that it was something that's necessary, especially with what's going on in the world today, and just how social media has obviously become a lot more prevalent in everyday life. So a new policy was written. We had our meeting on Friday. We went over that. We made some changes to it, but we did recommend that this policy be adopted. And so I think we just need a roll call vote to approve the social media policy. If there are any questions.
The only thing that I would add is that we will be asked to sign, as board members and as staff, we will be asked to sign receipt of the social media policy.
So do you want that approved policy sent out by Danielle to everybody, then we sign, scan, and send back, or are you going to have like a signature page? How best do you want to do that?
You know, Jeff, that's an excellent question. We're not all in a room to complete and sign this, are we?
Wasn't there discussion at our meeting, Natalie, about
The electronic
signature and us discussing it a little more at our next Tri-P meeting at the beginning of December and bringing that to the table and at our December meeting?
I agree. Thank you.
Mm-hmm. So it's forthcoming.
Okay.
Any other questions or comments? All right, Danielle, if we could do a roll call vote then, please.
Sure. Melanie Beam,
Aye.
Heather Campbell,
Aye.
Jennifer Demuth,
Aye.
Ryan Dunn,
Aye.
Brian Craig,
Aye.
Mark Murphy.
Aye.
Marion Audie,
Aye.
Holly Payton Miller,
Aye.
Julie Smith,
Aye.
and Maureen Stoneman.
Aye.
Motion carried.
Anything else you need to bring up, Maureen?
Nope, that's it from the Tri-P committee.
Okay, thank you. And thanks for that committee for getting together quickly on that to address that policy before the board meeting. So Natalie, we're up to you for the director's report.
Yeah, this is going to be a relatively quick director's report, starting off with the celebratory well done board members and well done staff. Our levy passed by the highest rate that it's ever passed, 68.9%, which I'm preferring to round up to 69%. Did I say 68.9? Yeah. So that was incredibly positive, and again, at a time when we couldn't visit any civic groups and in a time where we couldn't do a lot of face-to-face outreach, the fact that we still passed by that high of a percentage, almost to the senior center level, which I feel like is the bar. You know, I couldn't be happier, and thank you all, committee and board and staff, for your effort and energy. It was truly appreciated, and we saw the results. The RSP grant, I talked about this briefly at our October meeting. We received $166,346 in federal funds. Like Dr. Dunn asked earlier, I applied for these dollars back in June, and you know, everybody is just incredibly far behind, and we just got the approval of it. The whole goal of this money is outreach, media campaign, podcast, billboards, mailers to every house in Tuscan Carroll County with a stigma reduction message. The Post-it notes that go on food delivery boxes or out pickup boxes. There are 2 mandatory trainings this week, tomorrow and Friday, that I have to participate in, where they introduce the requirements of the funding. So this is going to be a slow rollout, but the funding has to be spent. The initiative has to be completed by June 30th. So we had hoped that this would roll out as part of our levy efforts and stigma reduction efforts, but we'll take it. We'll take it when we can get it. And the last thing, if no one has any other questions, we have talked off and on about the state opioid response 2.0. That grant is due to OMOS, our state department, on Friday. Also federal funds. We're going to be requesting between the ADAMHS board, Carroll County Courts and Ohio Guidestone, almost $500,000. Some of it is expansion of current programming, remodeling of recovery house, medication assisted treatment, court liaison, and covering all of our courts in Tuscan, Carroll County. But I think the most exciting thing and new thing that we're doing, and Marianne can jump in on this as well, we have a subcommittee that met with our addiction task force. And one of the issues we kept bumping up against was people don't know who to call or where to call to start. And so if this is awarded, we're going to consider this a 2-year program, but we'll be marketing a specific addiction line for family members and individuals in recovery to call. It's not going to be 24 hours, but it is going to be a certain amount of hours every day. And they're going to connect with a navigator who will walk with that individual or family member from phone call to engagement and treatment services, at which point they then hand them off to that provider. So it's not just an information line, it's a conduit and connection to treatment services line. And I couldn't be more excited about us being able to bring this to the county. Anything you'd add, Marianne?
Oh, you said it great. But it's something we have so needed. And I can just speak from experience from years back that it is definitely needed. It was needed then, but it's probably more needed now. So thank you for thinking of this. And I hope this moves forward in the right direction. Sounds great though.
I think it's, yeah, great. The only other thing that I would add about SOAR, I had talked with with Guidestone extensively about including a men's residential. This is 2-year funding and we're only applying for year 1 at this point. 2 things. The grant states that if you haven't identified a property to purchase, you can apply for funds for a program if you haven't identified and moved forward with that process yet. And so while there's a place PFCS was looking at, we haven't moved forward with the purchase yet. The other part of that is the state often has capital funds, typically always has capital funds that are used, that are available for renovation or purchase of facilities for programming. They've halted that in light of the pandemic, but Mike has a connection at the state and they let him know that they're revisiting it in January. No promises that capital funds will be available, but they are revisiting it in January. And capital funds would pay for almost half of the mortgage over the length of the mortgage. Am I saying that correctly, Mike?
Yeah, it's a 50-50 grant. So whatever it is, they'll cover 50% with a 30-year forgiveness mortgage.
And so knowing that that capital 50% match isn't available until at the earliest January, we just didn't feel like it was the time to put it in. We are hoping to put it into the year 2 request. But that continues to be something that I know is a priority of the board, the community, and our staff. What questions do you have? I'm hearing
Natalie,
none.
I have one, Natalie. When will we know what Guidestone is planning on doing then with, or where they're at with the potential building?
They are looking for the board to have a role in purchasing. So if they're looking for us to purchase, the earliest we will go in is as soon as the capital funds are available. The property that they're looking at has been on the market for over a year, so they don't feel that there's an urgency to grab the property. And I don't know that it's going to be a great fit anyway, but I can't leave 50% match on the table knowing that it potentially is coming. So
sure.
I had a
discussion. How many beds would this facility hold?
Well, ultimately, it's going to depend on the size of facility that they get. Their women's is 12, so I'm sure that Pam's going to aim around that same level.
I had a conversation with the realtor who is also a personal friend of the people selling the property. And I inquired as to whether or not they would be interested in taking an earnest money offer on that property for a couple of months until we see if capital money would be available. She is checking with the owner on that to see that would at least secure the property for a small dollar amount for a couple of months. And then if capital money becomes available, they could move forward with it at that point.
Anything else for Natalie on any of those? Okay. All right, you're up again, Natalie. Impact of COVID. You
Actually,
or
I'm
Veronica?
going to hand that over to staff. Veronica, do you have a COVID program update?
Really, it hasn't changed much from our last meeting. You know, we're primarily doing telehealth at all of the agencies. However, the agencies still are offering face-to-face for those unique situations where that is needed. All services are still being offered in regards, you know, to medication, individual counseling, the IOPs. They were still offering those through hybrid, and the groups were doing virtual groups. So we're still moving forward with. They're taking intakes. They're providing the services to the community. They're putting out their resources on social media to keep the community aware of what they have to offer still. So I haven't heard, since the colors don't change until Thursdays, the meetings that I've been in, I haven't heard what purple is going to potentially mean for the agencies. Even the ones where we've had to backtrack off of case management transportation, they're still getting them connected to transportation to meet their needs if the case manager cannot provide the transportation for them. So I'll know more from the agencies after tomorrow if we have a color change, how that's going to impact their service delivery. Any questions about it?
Veronica, I heard a concern from someone in the community who works as a counselor at one of the agencies. And she found out that a client she had seen tested positive, and that would make her a close contact. And the agency asked her to go ahead and be tested and gave her the impression that if she tested negative, she could come back to work. And I just wanted to address, because that's a common misconception. If someone is placed in quarantine for being a close contact, that quarantine time period needs to be 14 days, because we know that symptoms can show up anywhere from 2 to 14 days. So if you're a close contact in quarantine and you want to get a test on day 5 and that's negative, you're welcome to do that. But all that means is that you were negative on day 5. It doesn't guarantee you won't become symptomatic on day 9. So that is why the quarantine time period is so important. In the past, we've had employers who say, this is an essential employee. I'm allowing them to work while quarantined as long as they don't have symptoms. But because of the very high volume of cases in our county, our health commissioners have strongly urged local employers to not allow quarantined workers to work while under quarantine, unless they're working from home, of course, where they can be separated from others. The only exception would be that those healthcare workers who can wear, full PPE and droplet protocol when they're working. So I just wanted to share that. It's a concern I actually heard privately from a friend of mine who's a counselor at one of the agencies yesterday evening. She shared that information with me.
If there is some type of bulletin or frequently asked question or something that the health department's created around that I can share with the agency directors, I'd be happy to do so. If you can email me that.
Yeah, sure. Yep. We've been sharing regular updates on our Facebook page, and yeah, we can do that. Thanks.
Would that be that flow chart that you have, or would it be some other document that talks about, because your flow chart kind of goes through that you've shared?
Yes, we have a flow chart. Exactly. Thank you. And we also have FAQs that we've used. And even our news release from last Thursday, when we learned that we meet 6 of the 7 indicators and are on the watch list for potentially being named a level 4 purple tomorrow. So yes, I can share that. Mm-hmm.
I just have a question. That does vary from county to county, correct? Or no? I'm not trying to put you on the spot, but I heard a very different statement from a close contact in my setting. So I guess I was wondering if that does vary health commissioner to health commissioner.
So the CDC and the Ohio Department of Health always recommend that someone who's quarantined, remain at home and work from home whenever possible. As I've stated, some employers have allowed, across the whole pandemic time period, some employers have said quarantine workers can work as long as they don't develop symptoms.
Okay.
And we had said that was okay for a time. I mean, we don't encourage it. That's certainly not what we practice here at the health department with our employees. But technically, we can't tell someone they can't do that.
Okay.
But it's not encouraged. It's not a recommendation. And as far as the recommendation to say, please don't do that right now because spread is so high in our county, that is county specific because, we are seeing so many cases. We saw 161 cases in a 24-hour time period yesterday.
Wow.
That is comparable to what they had in the whole city of Cleveland yesterday.
Wow.
Yeah, so it's a very serious, concerning situation.
And
Thanks for asking.
Well, and I appreciate your clarification because I again, work in a system that most of us are considered essential workers at this point. I know it could change. And I'm out here in Carroll County, but it's just good to have some clarifications so that if there is any misunderstanding, I'm able to support that too. So thank you.
You're welcome. And certainly you can work remotely and from home anytime.
Yep.
Sure. Jennifer, a question, as long as we're on that topic, I've noticed that the health department has changed how they are reporting on their website as far as they have dropped the number of active cases. Was there a reason for that?
So we changed the way we did our reporting out of necessity. Like everyone here, we've been impacted by employees that have had to quarantine. And as we, very publicly shared, our health commissioner, Katie's positive diagnosis today. So what was happening to create those daily data posts, we had one of our epidemiology team members spending anywhere from 2 to 4 hours a day going through each case line by line to gather all of that data to make sure it was accurate. Now, when we only had 100 active cases, it didn't take as long. Now we have hundreds of active cases. So rather than report too much and risk reporting inaccurate information, we are just reporting the numbers that we are sure of. And because we cannot devote that staff member's time to 4 hours a day to go line by line through all the cases at this time. But that's a great question and we appreciate you sharing that. And I actually can go back to sharing active cases. I'm planning to do that with the post today. So yeah, so we can share active cases. We're going to share our total number of cases. Of course, very sadly, our deaths and our recovered cases. Thank you.
Thank you.
Thank you. Any other COVID related updates, Natalie?
We have a fiscal update.
No, I would like to ask Jennifer a question if it's okay. Can you guys hear me?
Yes, you're a little.
Jennifer, is it expected that and this is specific as to me, and I hate to take up people's time, but if people that have had the virus that have active antibodies, are they expected that they could still be a carrier of the virus to infect other people, or not, or is there any information on that?
That's a great question. Of course, anyone who has had the virus, all of our early scientific research is showing you will carry an active antibody and be potentially immune for at least 3 months. It is possible, as you know, to carry the antibody longer than 3 months, but it won't be as strong or as prevalent in the body. So we do know reinfection is possible. So could someone who's had the virus still be a carrier? In some ways, yes. You can still be, at a location where you touch a surface that has the infection on it, and then you could touch something and pass that to someone else. So you could be a carrier in that way. Could you be a carrier in terms of like the viral load you yourself are carrying through the droplets you breathe out? I don't know that we have any conclusive science one way or the other that I've seen to answer that question.
Okay, thank you.
Mm-hmm. I have to bow out. Forgive me. Thanks, everyone.
Thank you.
Thank you, Jen.
I'm going to talk about the fiscal impact. I don't necessarily, we'll just call it a claims data update maybe. I wanted to thank Jen. She's always so calming in her updates before she left, but I'll shoot her an email. You heard Veronica talk about, she mentioned case management, and you've heard me say that those numbers are up a little bit. So this month, I'm just going to talk about case management, just to give you guys an example of what we're looking at here. So, and I took 2 months to compare October and November, and I combined those 2 months together. So I looked at October and November from 2019, and then October and November from 2020. Now, keep in mind that these claims, they are not real time, okay? It's easy to want to put that perspective to it, but it takes sometimes, by the time all of the notes are done and the billing office gets their paperwork, it can be 30 days out, sometimes more, depending on how many people are out or in quarantine or what have you. So just tuck that in the back of your mind. But for case management, in 2019, for October and November, CMH billed 265 units. For 2020, October and November, they billed 654 units. So you can see that case management is really something that's increased, I think, due to the pandemic. For CMH, their individual counseling numbers went down just a touch. And I think that's probably because people are more comfortable, not necessarily having a face-to-face or maybe even having the technology. It's hard to say. There's 1,000 things that could cause that number to go down. But I think they're compensating for it through case management, and it seems to be working. So that's good. And then if you look at PFCS for the same time span, in 2019, they did have a bit of a billing snafu in 2019. But for those 2 months in 2019, PFCS only billed 12 units of case management. And in 2020, they've billed 190 units. So it's not specific to CMH. The increase is, and I only looked at those two agencies because in Carroll County, it's a bit of a different scenario. So, and for PFCS, their individual counseling numbers have gone up significantly compared to last year as well. But just an idea of what we're looking at, and they definitely have some increase in case management. You heard Southeast possibly last month looking to add case manager services. So the need is there and it's being utilized.
Good. Thanks, Danielle.
Sure.
I just wanted to mention briefly, last month we talked a lot about the number of individuals seeking assistance with utility bills and rental assistance and those types of things. You'll notice there was a significant drop off this month. Part of that is there have been several pots of funding that have come out very recently. Pandemic relief funding is what they're calling it. It's specific for individuals who are impacted in some way by the pandemic. It's a little strange in what's happening because there are pots of money that are going to many different entities. The shelter has some that's specific for them to dole out. Job and Family Services has a pot. Harkness has a pot. So it's a little frustrating in that some of these funding sources are coming into the local homeless continuum and kind of bypassing this setup that we had in place to help individuals. But I'm not going to look a gift horse in the mouth. It's good that we're getting some funding out there for individuals, and they are being able to utilize that for back gas bills, back electric bills, which then takes the burden off of the ADAMHS board because anybody can apply for those, including individuals with behavioral health disorders. So that frees up some of our money to use maybe later down the road when the pandemic funding goes away, and people are still in need. So there is some relief there coming, and folks are definitely using it.
Yeah, yeah, sounds like that's pretty well communicated, the resources that are available. A lot of people are taking advantage, so. All right, any other updates on COVID for the ADAMHS board? Any? No? All right, room number 7, and we are gonna get our 2 o'clock deadline in, looks like. But don't wanna shortchange anything, so if you have anything to add, please do. Board meeting training due December 15th, so we got about a little less than a month to finish that. If you do not have that link, is that in, I don't think that's in this month, is it? It was in previous months. Yeah, it was in previous
Send it out.
months.
I sent it out via email, Jeff, because
Yeah.
you can just click on it and access.
Yeah, I think it was in an agenda too sometime back, but either way, if you don't have that reference, if you clean out your inbox or whatever and don't have that training link, please get that as soon as possible and finish that. Send the certificate to Danielle, is that correct?
Correct.
Okay. All right.
Natalie, would you be willing to just reshare that
Sure
link,
will.
please? Thank you.
Sure will, no problem.
Yeah, I think there's what, 3 topics we could choose from?
Correct. And I can't remember who it was that said that, maybe Brian, but somebody who had watched them said that they really should be watched by every new potential board member. It was ethics, it's roles and responsibilities, and I believe it's sunshine law. So I thought that was a very good point. And if the links stay active, I think that's a good plan for us.
Mm-hmm. Yep. Okay. All right, on new business, we have upcoming meetings, PR, actually be this Friday, or no, next Monday, 12:30, Tri-P, December 9th, and then our next board meeting, we are gonna have a December board meeting due to some county budget stuff that could be coming. So we are not gonna recess that, so we will meet in December. And then if anybody ever has any agenda items, ideas, topics, etc., please send those to Natalie or I, so we can get those reviewed and put on the agenda for future meetings. So, any other business to bring before the board? Any questions, comments on anything we've covered today? Everybody's muted, manually muted. Not digitally, right? Anything else for anybody? No? All right, well, we'll entertain a motion for adjournment.
I'll make that motion.
Mary Ann, thank you.
I'll second Ryan Dunn.
We are adjourned. So